to knock. I'm going to gel in. Hello, my name is Christian. I'm going to be your nursing student today. I'm going to be doing your postpartum assessment. Is that okay with you?
Yeah.
Okay. Can you please give me your full name, date of birth?
Brenda Wu.
Brenda Wu. Can you please give me your date of birth?
111.
111. Okay. And do you have any allergies that I should know about?
No.
Okay. Patient has no allergies. Okay. So the first thing I'm going to do, I'm going to be checking my patient's vital signs. I will be checking patient's temperature. Usually if it's elevated to above 100 degrees. It's usually normal after postpartum delivery for the first 24 hours. And after the first 24 hours, it should go away. Next, I will be checking the patient's pulse, checking for respirations. I'll be taking patient's blood pressure. And then, are you feeling any pain today?
No.
Okay. So if the patient was in pain, I would ask where the pain is, how they would rate that pain from 1 to 10, ask if they need medication, and would document the last time they had pain medication. Okay, so next I'll be using the double D method. The first B is breast. Are you feeling any soreness, any hard spots, heat, redness, or tenderness with your breasts?
No.
Okay, and are you currently breastfeeding?
Yeah.
Okay. Are your nipples, are they intact? Are they cracking? Is there any normal discharge?
No.
Okay. So to assess the breast, I would palpate in a circular motion, checking if there's any hard spots or any lumps. And then have you seen a lactation nurse already?
No.
Okay. So with lactation, make sure that you're feeding your baby every 2 to 3 hours. Make sure you start 5 minutes on each side. And then it'll usually increase with more feedings. So depending on how much the baby wants, I'll go ahead and just give them the milk. Okay, and early breastfeeding helps stimulate production of natural oxytocin, and it helps prevent uterine hemorrhage as well. Do you know what engorgement is?
No.
Okay, so engorgement, it's a fullness of the breast, usually a result of the lymphatic circulation, milk production, or a temporary vein congestion. So your breast may appear tight, swollen, or like bigger. Okay. All right. So next I'll be doing the U. So checking the uterus. So first I would sit my patient up. I'm going to listen to your breath sounds, your heart sounds, and your bowel sounds. Is that okay with you?
Yeah.
Okay. Go ahead and take deep breaths for me. Okay. Deep breaths. All right, we're going to listen to your heart, okay? Okay, can you go ahead and point to your belly button for me? Okay, so I'm going to be listening to your bowels. Okay, so your lungs sound normal, your heart sounds okay, and then your bowels they sound good as well, okay? All right, so now I'll be assessing for the fundus. So I would put some gloves on. I would find the pubic symphysis, and I will palpate to check for the fundus. So I'm going to check if it's firm or boggy. So usually if it's firm, usually that helps with control the bleeding, and I'm going to check if it's the fundus midline or if it's misplaced, and then I'm going to note the height of the fundus. It's checking if it's above the umbilicus or below the umbilicus. Okay, I'll go ahead and cover the patient back up. Okay, so the next one is checking the bowels. So have you passed any gas recently?
Yeah.
Okay, have you had a bowel movement since your delivery?
Yeah.
Okay, so usually patients that have had a pregnancy after delivery, they're usually constipated, so it's a pretty common problem. So we're going to make sure that the patients are drinking enough fluids and they're eating enough high dietary fiber foods. And if need be, we will be giving the patients stool softeners to help them. Okay? So next, I'll be checking your bladder. Okay. Have you used the bathroom since your delivery?
Yeah.
Okay. Have you had any trouble urinating, peeing, anything like that?
Yeah.
Okay. Is there any odors, abnormal odors with your urine?
Yeah.
Okay. So we're checking if the patient's had a UTI, because usually pregnant patients, they usually get a catheter to help them urinate during their pregnancy. Okay. So do you know how to clean your perineal area?
Yeah.
Okay, so usually to clean your perineal area, you want to always wipe from the front to the back to prevent introducing any type of bacteria that may cause a UTI. Okay. All right. So did you know what lochia is?
No.
Okay, so lochia basically stands for bleeding. So what you want to do is we want to check the pad of the patient, which I would note the amount of the. I would know the amount, the color, if there's any odor, or there's any abnormal consistency. Did you know the 3 phases of the lochia?
Yeah.
So the first phase is the lochia rubra, which is like a dark red consistency, which also has like a abnormal odor. The second phase is the lochia serosa, so that's usually like a pinkish brown color. And then the third phase is the lochia alba, which is like a yellowish creamy color. Okay? Okay?
Okay.
Okay, so next I'll be doing the episiotomy. Episiotomy is a surgical incision by a doctor which helps widen the vagina for delivery. Okay, so I will go ahead and ask the patient to turn to the side. Turn to your side, on your right side. Okay. So, next, fix you up right quick. So, I will be checking the perineum, make sure there's nothing abnormal, make sure that she's healing okay. We'll check for hemorrhoids, and would assess the back if they had a epidural, and then I would check a spinal side if they had a C-section. So I would I would check if there's any tears. So I would check if there's any redness, any edema, ecchymosis, or any type of drainage, and I would do an approximation of like the surgical site. So next, I will go ahead and just let the patient turn back onto their back. Okay, and then next I will be checking for DVT or Holman sign. Okay, so I'll go ahead and just expose the leg. So I would ask the patient if they're able to dorsiflex their foot. Okay, so I would be checking the leg if there's any soreness, there's warmth, any type of tenderness or anything like that. And I would check and palpate, make sure that everything's okay. And it's usually unilateral, so it wouldn't be happening on both sides. Okay, I'll go ahead and cover them up. And I would be checking for edema as well. Okay, so next I will be doing education, making sure that the patient knows that do you experience any type of excessive bleeding or anything like that, go ahead and please call your doctor, notify us, and we'll help you out as best we can. During the assessment, making sure the patient's doing okay emotionally, checking if they're happy, depressed, if they're angry, if they're feeling anxious or depressed. Okay, and then so I'll go ahead and just cover the patient. Are you doing okay? Did you need anything from me?
No.
Okay, here's your call light. Let me know if you need anything. Go ahead and take off my gloves, gel out, and document.